That's so much more pleasant than some of the alarms that are out there.
And with the nighttime routine, getting good, deep sleep is so important.
Hmm.
And when we think about planning for the next day, you're absolutely right. When we plan our sleep hygiene out and we think
Yep.
about ourselves as living, breathing organisms that need the right temperature, that
Hmm.
need to feel safe and comfy, to have the soft sheets. Sometimes I'll ask people to describe, like, what does the bedroom look like? Tell me about the sheets. How do they feel? And it's like, I never really thought about my sheets. And then people will go and actually go out and purchase softer sheets because the bedroom ritual is so important.
Hmm. I love it. So you have what I would call a sensory lens. You're considering the sensory environment of the sleep, which I actually find not to be very common for non-neurodivergent clinicians or people. So I absolutely adore that you have that sensory lens and you're already thinking about, like, how do we not just make this okay, but make this a pleasant experience that people look forward to and that's nurturing.
In some cultures, sleep is huge. Here, when we think about sleep, we're thinking about, oh, that person's lazy. But in some cultures,
Hmm.
sleep is like revered.
Hmm.
In some Asian cultures, if they see someone sleeping, it means that they worked hard. It's like, and in some
Huh.
cultures, sleeping is considered a thing that needs to be protected because rest is restorative and there's no shame in your sleep game. So with
Hmm.
my clients, it's like, okay, let's pick out some pajamas that we really like, that we get excited about, that make us look forward to this sleep experience. Because we think of sleep as a time when we're like, our brain's off, we don't remember it, but it's not true. Our brains have a lot of activity during sleep. So let's make sleep an experience that is important and revered because it sets us up for the next day.
So I'm having a thought as I'm listening to you talk that I really like this line of thinking of, like, what is your psychology of sleep, in a sense of what are your beliefs about what sleep is? Is this annoying thing that your body just demands? Is it something that you've earned? Is it pleasurable? Is it something to be, like, respected and honored? I love that, and I think that's probably a really powerful place to start, of just like, what are your beliefs about sleep, the function of it, like, how do you feel about it? It's really interesting.
And sleep is a challenge with anxiety. In some people with
Hmm.
ADHD, sleep is a challenge. In some
Big challenge.
autistic individuals, it's a challenge. And we know
Yep.
in perimenopause, it's a really big challenge because the
Hmm.
hormonal fluctuations change the architecture of the sleep. So